I'm Rebecca. I'm an occupational therapist at Northern Colorado Rehab Hospital. I'm going to be talking to you today briefly about occupational therapy and the role that we have in treating spinal cord patients. So with rehab and occupational therapy, day one we identify caregiver support. We start looking at what the home setup is like. The treatment might look a little bit different depending on the nature of the injury, whether that is a complete spinal cord injury or incomplete. We look at kind of promoting and facilitating what neurological functions are remaining, kind of really promoting what they have. And if the nature is an incomplete injury, how can we modify their lifestyle so that they can get back to those daily routines? Being able to take care of themselves, get dressed, go to the bathroom, get around their house. With physical therapy and respiratory therapy, speech therapy, nursing, it's a pretty big team approach where we all work together. We're looking at can they manage their own bladder and bowel functions? How's their breathing? Do they need any supplemental oxygen? Is their swallowing okay? So we're kind of looking at the individual as a whole and seeing where we can help out. One cool thing that we do here, we get they call it like an ATP, so an assistive technology professional. In pretty soon, within like the first couple of days, we get that individual with the injury the appropriate equipment, like if they need a power wheelchair or a special wheelchair with seating that kind of relieves pressure, so that they get that experience with the device that they will go home with. It's kind of a unique approach. We try to get everything set up early on so that they can actually go home with us during their therapy. We'll do a home evaluation, really involve the caregivers, because chances are these folks are going to need some help going home. So the big goal of rehab is to get the patient as independent as possible and back to their daily life, daily routines. We work very hard to try to give them some exercise programs that they can do going home, that their caregivers can do. The next step after they go home is generally home health therapy, where that kind of continues the rehab process. And then ultimately we'd love to see these patients back in our facility or an outpatient facility so they can kind of even continue that growth. So if you're interested in any more information, you can visit our website or stop in our facility at the front desk, and tours are available whenever during the day.